Hi, a friend from Scotland gave me a Minke whale vertebra last year that I thought you'd like to have a look at. It's really big. Wow, what a great structure. And I thought I'd use it to show you some of the different fractures that chiropractors sometimes see on patients that come and see us with back pain. And I'll try and do them kind of in the order of most common to least common. So the fracture that we see most commonly is a compression fracture, and this is where this part of the vertebra, the central bit, the body of the vertebra gets squashed. And if you imagine that the structure of the bone is a little bit like a honeycomb, and then if you put too much weight through it, it can get squashed and the honeycomb structure breaks in on itself, and that's called a compression fracture because it's been compressed. So if you imagine a frail older person lifting a heavy flower pot or putting out a dustbin or even lifting a heavy saucepan with food in it, that can sometimes be enough on a patient who's osteoporotic to break the spine there. And that's called an osteoporotic compression fracture. And of course, it's painful when it happens. Sometimes the pain will creep on a little bit later as it becomes a little bit more inflamed. But the problem is that it's very easy to misdiagnose this, because if you imagine that the skin is here and there's lots of muscle, the fracture is very deep. So it's very easy to prod the patient's back and not find anything terribly uncomfortable. And so perhaps when the patient goes to their GP or to the chiropractor or physio complaining of the problem, it's very easy for the practitioner to initially miss it because they prod around and don't find any pain. The giveaway for these problems is that when the patient changes position and goes from vertical to horizontal, the fracture tends to come apart, and when they go from horizontal to vertical, the fracture recompresses. So this sort of spiky trabecular structure that's broken is really painful. So it's the change in position coupled with the sort of disparity with the findings of touching the patient that make one suspect it. So a compression fracture is the most common type of fracture that we see. And normally that's in osteoporotic older patients. Sometimes it can happen when someone has a fall, but in a younger person who has a fall, what can happen is that the bottom vertebra, often see the bottom last one or the penultimate vertebra, can actually break into two parts. And if you see this is got the spinal canal here, what can happen is that these two bits can break. So the front part can become separate to the back part, and you end up with an instability this way. And because some nerves come out in between the vertebrae, that can actually cause pressure on the nerves that go down into the legs. So this type of spondylitic fracture will tend to, when it's causing problems, give rise to leg pain. Sometimes years later, as the fracture becomes increasingly unstable. These fractures don't heal up, these ones, because what happens is that the front part of the spine tends to come forward, leaving the rear part behind. So these bits of bone never come together again, really, and so you end up with two bits of bone, a bit like a polo that you've bitten and it breaks into two parts. So you have an instability. Sometimes that instability is not a problem, but if the patient develops problems with a hip or a knee, then the overload from lower down the connective chain can cause problems on the spine and increase the instability, and then the patient can end up with a sciatic type of problem. So in terms of getting those people better, we often prescribe core stability exercises. Lots of you will be doing Pilates type exercises and so on, which is really great to give the spine a load of support. But sometimes if it's becoming increasingly unstable as the patient gets older, they'll end up needing these two bits bolted together with some metal. So they'll go off to the orthopedic department and have a fusion, and that helps to stabilize the segment. So we've had two types of fracture so far. Another type of fracture that we see sometimes is a fracture of the tip of the spinous process. And back in the old days when we used to do lots of manual labouring, digging clay out of the ground, digging holes in the ground, clay was particularly heavy, and so what could happen sometimes is that the muscles in the back here would actually pull so hard on this tip of the spinous process that you've got a bit break off here, and that's called a clay shoveler's fracture back in the day. We don't see that type of fracture in the upper back very much, but what we do see sometimes is people who slide down the stairs and the stair actually just breaks off a little bit here, and you end up with a very tender bit on the spine. Sometimes you can feel the little bit of bone that's broken off just moving around. So that's kind of what they call an avulsion fracture. And it's often quite sore, but there's not much you can do about it. It just tends to gradually settle down. The body sort of breaks down the broken bit, and the pain all just goes away. What else do we sometimes see? Very occasionally we'll see a transverse process has been broken, and it takes quite a lot to break a transverse process. So I guess the most common sort of injury is where someone gets thrown from a moving vehicle and has a high speed trauma smack, and the vertebra gets broken that way. Yeah, that's pretty painful, but often the patient will end up in intensive care and have all sorts of investigations, and that sort of injury is not something that a patient will come to the chiropractor complaining about because they know they've got the problem anyway. It's something that's diagnosed in intensive care sometimes, and often there'll be multiple transverse process fractures. Mostly that's it in terms of spinal fractures. Obviously, most problems that we see aren't fractures. We see all sorts of different sorts of spinal problems. But anyway, I thought this Minke whale vertebra was particularly beautiful, so I thought I'd show it to you. And look at those beautiful sort of patterns on the end of the vertebra. They're absolutely gorgeous. Imagine this beautiful whale swimming through the sea. Absolutely gorgeous. So there you go. Yeah, chiropractors see all sorts of different things, including fractures. We don't treat minke whales, by the way. So okay. Anyway, have a great weekend. Bye for now.